Hi, I'm Dr. Nima Massoomi, a board-certified oral surgeon. I practice in Cupertino, Los Gatos, San Francisco, and I teach part-time at University Pacific. I've been there for, since 2007, so almost over 15 years now. Mostly I would say I'm again, fixer-upper, like to tinker with things. So if I'm not at the office fixing people's, smiles and jaws and other things, I'm probably at home fixing something. I've always enjoyed healthcare. My dad is a retired surgeon. That's what I grew up with. My whole family, we've got a bunch of doctors and physicians and surgeons. So I've always been exposed to that. But at the same time, again, I've always liked the engineering aspects of things. And in terms of what I do, oral surgery and dentistry in general, so I think it's a combination of both. Most of us get into this to help people out, and everything else will follow. That's how I think of it. So I've just enjoyed improving people's smiles and, getting them out of pain. Those are really my main drivers. We're probably one of the most high-tech oral surgery practices, if not in Silicon Valley, California, probably in the country. We had the first robot that was FDA approved here in 2018. I was one of the clinical advisors that we started working on the robot in 2012, so almost 10 years ago now. We did the first robotically placed implant here. And so we really think of us as cutting edge, try to use technology. Within the past 2 years, we've added 3D printers where we're printing our own guides and models and even teeth at this point. So it's just amazing the pace with which technology is moving the boundaries and what we can get accomplished. And that's how we're able to kind of deliver high quality care and in a timely manner to all of our patients. It's always been a dream of mine to have a multi-group specialty type of setting with people that have the same mindset where patients come first. I've worked with Dr. Shalak over the past few years, just being involved in the Senatorial board and just doing some volunteer work. Dr. Afifi was actually one of my students years ago, and he finished up a few years back at UCSF. Both are bright kids with lots of experience, and again, patient first mentality. Their heart is in the right place, so that's who I like to kind of associate myself with. But I'm really blessed that I have a group of people around me that have my back, that I can rely on. But I really consider myself like family, honestly. Yeah.
Well, I come here because they always make me, feel comfortable, like really nice people, like especially him, and all the assistants are really nice and good people. Like they make me feel like really comfortable. If I had any questions or whatever I have, they always explain it, well to me, and they do their best to make, me be happy.
My goal is to always make sure that, we change people's point of view in terms of how oral surgery typically is, and we want to make it as painless as possible. And most patients, honestly, when they come back week, 10 days later for their follow-up appointment, they're like, "Doc, I had no pain. What did you give me?" I use minimally invasive techniques. We give preoperative pain medications. We really try to stay ahead of the curve by giving a lot of proactive medications and measures to make sure that the recovery is better. Patient first. Think of your patient as a family member. And I think if anybody does that, then you can't go wrong.